Okay, gang, it is Fraxel Friday at PFRANKMD. I even have the Fraxel socks on. And I am not just talking the talk, I am walking the walk. Because every year I do my own Fraxel. Now it's rare that I just use the Fraxel when we do laser resurfacing. It's always 4 or 5 days of downtime, a day of redness, a day of looking tan, and a couple of days of just kind of like dry, flaky skin. But we also want to take advantage of that recovery to remove broken capillaries, to remove some of the bigger brown spots. Remember, the Fraxel is like the Windex of the skin. But sometimes you have some spots you have to treat. So at PFRANKMD, we have various technologies that we can use. So people always ask me how I keep my skin looking good. This is how I do it. Now, the recovery is always a little different for everybody. I'm on maintenance schedule. I've done this maybe 12, 15 times over my life. I don't have much to remove. So although I'll use pretty aggressive settings, or I won't, my nurse provider, where's Jen? Where is she? She's right over there. Even though she'll use pretty aggressive settings, it's not going to be that much of a recovery for me. The more you have, the more reactive it is. But it's always about a full week till your skin is perfect, to your event ready, and about 4 days of a little bit of social downtime. I kind of like it. It makes me feel a little gruff. You'll see me during the recovery this weekend. And let's get started.
Let's get started.
All right. Oh, it feels so good. I don't know why people call this painful at all. Only sat a few minutes of anesthesia.
That's 1.24.
Oh, that's more than enough for me. I still want you to use the peak on a few spots.
Yeah.
I'm good. Fine.
Good?
Yeah.
All right.
Woo. I'm back. All right. Woo. That was not too bad at all. Now for some spot treatment. All right, gang. We are post Fraxel. But we're not done. Now we're going to use a little Pico technology to get some of the bigger spots that are left over. The Fraxel actually brought some of them out. They look a little darker. Right now I just look a little red, maybe a little tan. I feel a little bit of burning, but you know, it's like a 4 out of 10 for me right now. I'm going to sit with a little ice afterwards, take a little anti-inflammatory. Nurse Jen is going to zap a few spots because when I am healed, I want perfection. Lots of sunscreen for me this weekend. How's the whiteness?
Good.
I don't remember that.
Yeah. You had a big one right there. You'll see.
God damn, I'm gorgeous. Gotta stay on brand, you know.
Thank you.
All right, PFRANKMD fans. Now we are going to talk Fraxel post-care. As you may or may not know, I did my Fraxel yesterday. It's Saturday. It's about 24 hours after the procedure. I feel fine. As you can see, I do look like a sunburn. I'm a little puffy around the eyes. I like to go strong there for dark circles and fine lines. I have a bunch of individual burns from sunspots that I used pico lasers to remove. But overall, I'm just red. I'm swollen. I've been to SoulCycle today. No one noticed. I'm wearing a hat. I'm wearing sunscreen. But now it's time to talk about a little PFRANKMD post-Fraxel skincare. I like to keep the skincare very basic. For women, makeup, moisturizer, sunscreen, that's really it. You really don't want to overdo moisturizer because then the skin never exfoliates like it's supposed to. It's supposed to be dry and exfoliate. People who may use things like Aquaphor or Vaseline, you're really just delaying the process. So moisture is good, but you really don't need to do it more than 2 or 3 times a day. Again, we're going to keep it really simple. We're going to start with the PFRANKMD cleanser. It's an aloe vera based gentle cleanser, and you really don't want to do anything that's going to scrub too much. You just want to gently cleanse the face. Then I'm going to use what I normally use for my daily moisturizer, which I recommend for everybody, which is PFRANKMD Vitality Cream. It's a rather rich antioxidant moisturizer. It's not so rich that it leaves a film on the skin, but I like a thick moisturizer, and it's great as an anti-inflammatory as well. And again, just really a thin layer. I let that kind of dry in a little bit. Everything should be really patting or gentle rubbing when it comes to Fraxel post-care. It's not painful, but we've all had a sunburn before, so your skin is just going to be a bit sensitive. The most important part, mineral-based sunscreen, the PFRANKMD UV shade. It's about an SPF 40. It does have a little bit of a tint in it, which I like. It covers up the redness a little bit. Women like it because it's a bit of a silicone base and has almost a little foundation quality. Evens out the skin tones, and most importantly, doesn't leave you with that white film that zinc mineral-based sunscreens can leave. Now, for people who do like to wear makeup and don't want to take it off and keep reapplying, there's the UV shade brush, which is really amazing. You have, it's almost like a makeup touch-up with the mineral-based sunscreen. So they could just kind of rub it over the makeup so they don't have to completely wash off and reapply. Also, for people who have deeper pigmentary issues like melasma, post-inflammatory pigmentation, I do recommend a color-correcting serum. We could use this not only after going forward to prevent rebound of pigment from the Fraxel, but also during the healing. The active ingredient is tranexamic acid, which we use orally as well to help people with pigmentation with severe cases. It's an amazing prescription strength serum. So again, we're keeping it to the basics. The most important thing, it's a beautiful day, is just keeping out of the sun. I'm going to be outdoors. I'm going to be enjoying myself, exercising. I have a strong mineral-based sunscreen. I'm going to wear a baseball cap. I'm going to wear my little hoodie, and I'm just going to do my best to stay in the shade. But that's really it. I'm going to do that about 2, max 3 times a day, what I just did. Tomorrow the skin's going to start getting darker, and you'll see how we progress. Have a good day. Okay, fans, and we are back, and it is post day 3 of Fraxel. It is Monday morning. I did it Friday in the late afternoon, and as you can see, the swelling is pretty much gone. I haven't shaved. I usually tell guys wait a few days to shave. I am going to shave today on post-op day 3. My skin is not really sensitive anymore, but it's feeling very sandpapery and rough. And I don't know if you can see, but the dark spots that were zapped are definitely turning dark, and there's like a pixelated brownness. Now, people think that because their skin is dry, they want to exfoliate it off. You really don't want to rush this process. Again, 2-3 times a day, cleanser, moisturizer, sunscreen. Women could wear makeup. Guys, I usually tell to shave about 3 days later, once that sensitive skin issue is gone. But really now at day 3, day 4, everything is going to come off because the new skin underneath is pushing out and exfoliating. And this is not just true of Fraxel, it's true of all resurfacing procedures. Fractional resurfacing certainly offers the greatest efficacy with the least amount of downtime and risk. I did the Fraxel Dual. There are other types of fractional non-ablative resurfacing devices out there. I prefer the Fraxel name brand. And if you are asking or getting Fraxel, make sure when they say Fraxel, it is the name brand because there are a lot of other devices out there. Again, we combine several other lasers, broken capillaries, V-beam, XLD, Pico for dark spots. And that's it. I feel good. I'm looking forward to a shave. I'm not going to rub that skin off. Day 3, I'm certainly, good enough for work. Obviously, if you have a lot of sun damage that you started with, you're going to see a lot more of that browning. I'm more of a, although I did a strong treatment, it's more of a maintenance treatment for me. I don't have that much brown spot, so I look pretty presentable on day 3. Others are going to see a little bit more of an extreme recovery. So stay tuned, and maybe I'll put up a question box, see if anybody has questions about post-laser treatments. Okay guys, one more thing. I'm wearing this because I did work out today. People always ask about working out. You can work out the next day or even that evening after Fraxel. If you're going to sweat a lot, you definitely want to keep a wet towel so the salts and the sweat don't sink. Okay gang, welcome back PFRANKMD fans. I know I'm taking a rare lunch break today for my recovery for Fraxel. I'm having the famous Sandra help me out to help do a little mild exfoliation of the skin. I did this on Friday. It's now Wednesday, about 5 days later. In the first day or two after Fraxel, you want to do things anti-inflammatory. So a little oxygen facial, some LED lights to calm this down. None of these things are absolutely necessary, but they are certainly a plus in the healing process and making sure you get the best and most optimal result for Fraxel resurfacing. No matter how many lasers you're using, it's always about 4 to 7 days to recovery. Socially about 4 days, but it's really always a full week until your skin really feels like itself. So now I'm at like the exfoliation phase. I still have a little bit of brownness and some spots on the nose that have not come off yet. There's really no more inflammation or puffiness. So now we're gonna perform a little mild exfoliative treatment. She's gonna use her magic hands on me. So, it's always not only the laser, but what you do at home and how you do with an esthetician to give the optimal results. So you come into PFRANKMD, you get the full court press. So I'm gonna enjoy my little lunch break now and get rid of that last bit of flaking on the skin so I'm looking on brand for the weekend. Take it away, Sandra.
Okay. Dr. Fran come with a very nice little, flakes on the surface of the skin, which actually does the, purpose of the visit today, which we're going to start to exfoliate very, very nicely, but very, very gentle. We don't want to cause any aggravation in the skin. With the skin is still, healing. So at this moment, what we are doing is cleansing, very, very good cleansing on the skin, and we're going to proceed to do some, as I said, very fine exfoliation. Then we're going to treat the skin very gently with hyaluronic acid. Hyaluronic acid is fantastic for, to get the molecules into the skin, change the moisture into the skin, doesn't allow, to evaporate, the water from the skin. So the idea is to keep this moisture into the skin after this incredible treatment, which is the Fraxel.
The skin needs hydration after the Fraxel. You don't want to over moisturize because then the skin never exfoliates. But once you're in the final stages, you really want to hyperhydrate things because you really want to get that collagen boosting. Things always do well healing of any type of wound with a moist environment. So what you do at home and what you do in the treatment room is going to really give you the best results, which, you're seeing a very good result with the Fraxel after 1 week, but the ultimate result you'll see at 1 month. So the continued care that you perform in office or at home is going to make that difference to optimize the end result.
Please, ladies, please, gentlemen, don't exfoliate too hard.
Don't do this at home, kids. It's true. I tell people don't exfoliate at home. Sometimes patients will come into the office, we'll do a little bit for them. We have Sandra here to help out because you don't want to throw oil into the fire. Anything that could be useful also can be harmful in the wrong hands. So keep it to the professionals when we're doing professional treatments. And you see, it feels okay, but you can definitely tell that the skin is
already,
a little sensitive.
Yes,
that's normal, totally normal.
Yeah, I could tell already that the skin is a little bit pinkish, and then we're going to stop the exfoliation. It's more than enough at this moment, which is bringing all the little, flakes out of the skin, which is a perfect exfoliation.
Usually by the 5th day, we can do this. You definitely don't want to be doing this day 2, day 3, day 4. You really have to let the skin heal from the inside out to push the dead skin away. So, as we get older, the skin cell turnover also slows down. So on patients that are over 50 like me, or 60 or 70, it definitely prolongs things. I've had patients come back even after a week sometimes, and they still have some skin that needs to come up. I just did this on my 80-year-old dad, and it just takes a little longer. So getting a treatment like this, just to help optimize and speed up the healing process, is certainly going to help the end results. Someone in their 20s, by 4 days, they're completely healed. It's always the outer borders of the face that take longer. Most treatments heal from the medial portion to the lateral portion. So along the hairline, the front of the ear, these are areas where people will always complain of having a little bit of the extra unexfoliated skin.
So as we see a little pinkish, a little bit of redness, this is absolutely enough. And what we're going to start to do is healing with some oxygen and replenishing vitamins and, as I said, hyaluronic acid.
Yes.
This is hyaluronic acid. It has 2 molecules. One stays inside the skin, one stays on the surface of the skin. What it does is just like prevent for the evaporation of the water, of the skin water. So the idea is just to keep always, like having this 1 or 2 drops, on the skin, which, as I said, retains the water.
It's like a sponge. Hyaluronic acid is like the sponge. We inject this into people's faces, but it's a natural molecule found in the skin that is a humectant. So it's what retains hydration. So.
Next step is oxygen. Oxygen, we're going to spray it on the surface of the skin. We're going to apply a few vitamins, actually collagen, topical collagen, that is going to be very, very soothing on the skin. And these little red spots, they're going to start to calm down and hydrate at the same time. Okay, so now we're applying a very, very healing and hydrating mask. We're gonna leave it for a few minutes. It's going to be super replenished for, after Fraxel.
Feels rich.
Exactly, it should be feel a little rich, but it's smooth enough to make the skin, like supple, vibrant, more even skin tone, and help to remove all these, still dead cells.
This is like the turbo on the Fraxel. It like juices it up.
Correct. That's the turbo.
It's very important. So many people, not just in my office, but in general, now get cosmetic treatments. So many people also see estheticians, gets facials. I think it's very important to coordinate care, no matter who you're seeing, what provider you're seeing, to make sure that facialists, estheticians, the healthcare professionals, and the home care are all coordinated and in sync with each other. Okay, most people are doing these things for their self-care and for strong aesthetic result, and it's important that they're not doing things that don't counteract each other. You can't have too many chefs in the kitchen, so you want to make sure that the care is coordinated.
This is actually a very calming and soothing serum that is at the same time is hydrating. So his eyes, he's around.
She's saying I look tired. That's what she's saying.
They are a little bit more tender, this area.
Yeah.
So it is a little bit tender. Therefore, I'm using a much more soothing and gentle serum for the eye area. We're gonna cover the eyes in just a second because we are going to start with the LED light, the red LED light, which is very, very healing. And since we are showing this beautiful baby skin, and we are going to basically heal
it.
Yeah, heal it with the LED light.
Is the red light specific for healing?
It is one of the benefits, actually. Yeah, the blue light also can be very, very healing.
Yeah.
So therefore, I'm gonna just between the two lights, I'm gonna do the treatment. The red and the blue light.
It's going to go back and forth.
Back and forth. It's going to work with inflammation. It's going to work with more like even skin. Like the redness are gonna be calm down. So therefore, I'm gonna use the two lights.
All right, gang. So I'm now post Sandra Magic. After the Fraxel day 5, we did a little light exfoliation, some LED lights to decrease whatever inflammation's left. I can see, although there's still a little bit of the brown coming off, that's totally normal. You do not want to over exfoliate. The skin is fresh, it's even, it feels super, super hydrated, which is amazing. And I'm ready to get back to work, and I really think this is going to optimize the end result. And as always, it's teamwork at PFRANKMD. Teamwork makes the dream work, people.
Wonderful. At
PFRANKMD. All right.
Don't forget, this is a very important step. Don't forget about it.
Sunscreen.
Sunscreen.
UV shade, guys. It has a little tint in it, so people like that too. Anyway, stay tuned.